Hi everyone and welcome to my channel Hobet Bibi. This video of mine is about Bell's palsy, which is a sudden weakness in your facial muscles. In most cases the weakness is temporary and significantly improves over weeks. Earlier I posted a short video about this condition on my channel. I hope you have already seen that video, and today I will discuss this illness in detail. Well, the weakness makes half of your face appear to droop. Your smile is one-sided, and your eye on that side resists closing. Bell's palsy, also known as acute peripheral facial palsy of unknown cause, can occur at any age. The exact cause is unknown. It is believed to be the result of swelling and inflammation of the nerve that controls the muscles on one side of your face, or it might be a reaction that occurs after a viral infection. For most people, Bell's palsy is temporary. Symptoms usually start to improve within a few weeks, with complete recovery in about 6 to 9 months. A small number of people continue to have some Bell's palsy symptoms for life. Rarely, Bell's palsy can reoccur. Now I will tell you about the symptoms. Signs and symptoms of Bell's palsy come on suddenly and may include rapid onset of mild weakness to total paralysis on one side of your face, occurring within hours to days, as you can see on the images. Facial droop and difficulty making facial expressions such as closing your eye or smiling. Drooling, pain around the jaw or in or behind your ear on the affected side. Increased sensitivity to sound on the affected side. Headache can also occur. A loss of taste. Changes in the amount of tears and saliva you produce. In rare cases, Bell's palsy can affect the nerves on both sides of your face. You should seek immediate medical help if you experience any type of paralysis, because you may be having a stroke, which is a dangerous condition. Bell's palsy is not caused by a stroke, but it can cause similar symptoms. You should see your doctor if you experience facial weakness or drooping to find out the underlying cause and severity of the illness. Now I will tell you the causes of Bell's palsy. Although the exact reason Bell's palsy occurs is not clear, it is often related to having a viral infection. Viruses that have been linked to Bell's palsy include viruses that cause cold sores and genital herpes, that is herpes simplex virus, chickenpox and shingles, herpes zoster virus. Well, on my channel there is already a video about chickenpox and shingles. You can see those videos. Okay. Infectious mononucleosis virus, that is Epstein-Barr virus, can also cause Bell's palsy. Cytomegalovirus infections. Respiratory illnesses viruses such as adenoviruses can cause this also. German measles, which is also known as rubella virus, can also be responsible. And then mumps virus can also be the causative agent. And this flu due to influenza B virus can also be the reason. Okay. And there is another virus which is known as Coxsackie virus that causes hand, foot and mouth disease, may also be responsible. The seventh cranial nerve, that is facial nerve, that controls your facial muscle, passes through a narrow corridor of bone on its way to your face. In Bell's palsy, that nerve becomes inflamed and swollen, usually related to a viral infection. Besides facial muscle, the nerve affects tears, saliva, taste, and a small bone in the middle of your ear. Now I will tell you the risk factors. Bell's palsy occurs more often in people who are pregnant, especially during the third trimester, or who are in the first week after giving birth. And this pregnancy can be a risk factor, and of course the females are affected in this condition, but as I told you, it can occur at any age, and also males and females are affected equally. Okay, usually. Okay, I mean, this is not that in some disease like they are common in women, and some illnesses are common in males. So in this case, I mean, in Bell's palsy, both sexes are equally affected, but I'm telling you the risk factors. I mean, pregnancy, especially the last trimester, is one of the risk factors. Okay. Also, if there is a history of an upper respiratory infection such as the flu or cold, this could be a risk factor. If some patients who are diabetic, this diabetes can also be a risk factor. Okay. Recurrent attacks of Bell's palsy are rare, but in some of these cases, there is a family history of recurrent attacks, suggesting a possible genetic predisposition to Bell's palsy. Now I will tell you the complications. A mild case of Bell's palsy normally disappears within a month. Recovery from a more severe case involving total paralysis varies. Complications may include irreversible damage to your facial nerve, abnormal regrowth of nerve fibers. This may result in involuntary contraction of certain muscles when you are trying to move others. This is known as synkinesis. For example, when you smile, the eye on the affected side may close. Partial or complete blindness of the eye that won't close due to excessive dryness and scratching of the clear protective covering of the eye, that is cornea, can also occur. Okay. Now I will tell you about the diagnosis. Well, in most cases when patients come to us, it's very easy to diagnose just by looking at the face of the patient. Okay. And there is no specific test for Bell's palsy. We will look at your face and ask you to move your facial muscle by closing your eyes, lifting your brow, showing your teeth, and frowning, among other movements. Other conditions such as stroke, infections, Lyme disease, and tumors can cause facial muscle weakness that mimics Bell's palsy. If the cause of your symptom is not clear, then we may recommend other tests that include electromyography, that is EMG. The test can confirm the presence of nerve damage and determine its severity. An EMG measures the electrical activity of a muscle in response to stimulation and the nature and speed of the conduction of electrical impulses along a nerve. We may order some imaging scans such as magnetic resonance imaging, MRI, or computerized tomography, that is CT. It may be needed on occasion to rule out other possible sources of pressure on the facial nerve, such as a tumor or skull fracture. Now I will tell you about the treatment. Most people with Bell's palsy recover fully with or without treatment. There is no one-size-fits-all treatment for Bell's palsy, but your doctor may suggest medication or physical therapy to help speed your recovery. Surgery is rarely an option for Bell's palsy. Now I will tell you about the medication. Commonly used medication to treat Bell's palsy include corticosteroids such as prednisolone are powerful anti-inflammatory agents. If they can reduce the swelling of the facial nerve, it will fit more comfortably within the bony corridor that surrounds it. Corticosteroids may work best if they are started within a few days, within 72 hours, especially when your symptoms will start. Now here I should tell you the dose of prednisolone, which is commonly used drug. Well, this can be used for 10 days total. Initial 5 days you need to take 60 milligram daily in divided doses. Usually the prednisolone is available in the strength of 5 milligram, so you can take 12 tablets every day. Okay, you can divide the daily dose, like 4 tablets in the morning, 4 in the afternoon, then 4 at night. Okay. So this 12 tablets of 5 mg will be 60 milligram per day dose that you have to take for 5 days. Okay. Then after 5 days you have to reduce it every day. That is known as tapering dose. 10 mg you have to reduce. It means that for, let's say, for 5 days you are taking 60 mg daily. Then on the 6th day you reduce 10 milligram. Then and on 6th day you have to take 50 milligram, and 7th day if you reduce another 10, then 40 mg. Similarly on 8th day it will be 30 mg, and on 9th day it will be 20 mg, and on 10th and last day and that will be only 10 milligram. So this is a 10 day course for Bell's palsy, for this prednisolone. Okay. Sometimes in some cases we may prescribe antiviral drugs. Well, the role of antiviral drugs remains unsettled. Antivirals alone have shown no benefit compared with placebo. Antivirals added to steroids are possibly beneficial for some people with Bell's palsy, but this is still unproved. However, despite this, this tablet, C-clover, that comes with the name of Vortex, or acyclovir that comes with the name of Zovirex, is sometimes given in combination with prednisolone in people with severe facial palsy. Physical therapy. Paralyzed muscle can shrink and shorten, causing permanent contractures. A physical therapist can teach you how to massage and exercise your facial muscle to help prevent this from occurring. Surgery. In the past, decompression surgery was used to relieve the pressure on the facial nerve by opening the bony passage that the nerve passes through. Today, decompression surgery is not recommended. Facial nerve injury and permanent hearing loss are possible risks associated with this surgery. Rarely, plastic surgery may be needed to correct lasting facial nerve problems. Facial reanimation helps to make the face look more even and may restore facial movement. Examples of this type of surgery include eyebrow lift, eyelid lift, facial implants, and nerve grafts. Some procedures such as an eyebrow lift may need to be repeated after several years. Now I should tell you some lifestyle and home remedies. Home treatment may include protecting the eye you cannot close, using lubricating eye drops. These artificial tears will help you keep your eye moist. Wearing glasses or goggles during the day and an eye patch at night can protect your eye from getting poked or scratched. Taking over the counter pain reliever, aspirin, ibuprofen, or acetaminophen, which come with the name of Tylenol, may help ease your pain. Doing your physical therapy exercises, massaging and exercising your face according to your physical therapist's advice may help relax your facial muscles. Now I can tell you some role of alternative medicine. There's a little scientific evidence to support the use of alternative medicine for people with Bell's palsy. Some people with the condition may benefit from the acupuncture, placing thin needles into a specific point in your skin helps stimulate nerves and muscles, which may offer some relief. Biofeedback training. By teaching you to use your thoughts to control your body, biofeedback training may help you gain better control over your facial muscles. This was my video about Bell's palsy. I hope you like this video. If you have any questions about this condition, you can post your question in the comment section of this video. And on my channel Hobet BB, there are so many videos. Till now I have posted more than 350 videos about different illnesses. Okay, and if you are suffering, if your loved one is suffering from any illness, you can watch that video on my channel. Okay, and if you cannot find a video about a particular illness, you can ask me in the comment section, and if I find a time, I'll try to make a video about your illness. Okay, and if I don't find a time, I'll try to reply to your comment as soon as possible. Thanks for watching this video. See you in next video. Bye for now.